All right, hey everybody. We're gonna talk about art lines and how to set it up and some tips and tricks. If you come over here to the drawer, you can get all your supplies. What you're gonna get is a chip clip, a liter bag from the mini mart or from the med room, a liter pressure bag, a wrist aid so they don't bend their wrist when they have the art line in, a bio patch, sutures, transducer, and depending on the provider, they have a longer art line. It just has a longer handle and a guide wire, or the shorter one has a shorter guide wire. Most providers like the shorter one. All right, so now we're going to talk about putting it together. What you want to do is grab your chip clip and hook it onto the IV pole. Put your transducer in your syringe. Usually it comes extended out. All you gotta do is just push it in to your clip. And then you wanna put the syringe part with the numbers so you can read them, and the transducer right next to it. Usually the transducer comes with this clearish white cap, has a hole in the middle, just toss it. And then in the transducer bag, it comes with a white cap. You want to put this on, and then you want to pump the pressure bag up with the liter, and that way you can prime your line. You can't prime the line until this is pressurized, and once it is pressurized, then you pull on this little blue tabby, it'll prime, you'll get all the air out, and the saline comes out. And you really want to have this all set up before the doctor inserts the art line, because if they insert the art line while you're doing this, you're just going to have a lot of bloody mess. So really, you're going to be standing like this while the provider is putting in the art line. That way they can just reach over, grab it, and insert the tubing to the art line. Now to prime the tubing, now we're going to zero the art line. You want to move this chip to the phlebostatic axis, and one way you can do it is by grabbing the carpenter's level, and where the patient is, phlebostatic axis is mid-axillary, fourth intercostal, and you're just going to go like this, and you want the bubble to be in the center of these two lines. So once you're at that, you've moved the chip to where you need. And remember, when you do zero it, you want the patient in their resting spot, because every time you raise or lower the bed, you're going to have to zero it out. So you want it in the lowest position where they're going to be comfortable. So after you get that, you go to your monitor, and the art line should take over either if there's a missing vital, or what I usually do is I'll usually cancel out the respirations, because the most important would be your oxygen and your cardiac beats. So once you have the art line up, you click on the waveform, you hit, oh, I missed a step, sorry. You want to turn it off to the patient, take off the cap. Now you're open to atmospheric pressure. Now you can click on the zero. You're gonna hit zero. It's gonna count down. Then you're gonna get a parentheses with a zero. And now you're zero to atmospheric pressure. So anything that the body's putting out will be the actual blood pressure. So you can turn it off to atmospheric pressure. Get your white cap, put it on, and you should see a nice waveform with the dichotic notch. That's it.